Hello, Professor. I hope you're doing well. For the sake of time, I am just going to jump right into the presentation. All right. Now, for my clinical assessment, I chose Tony Stark, particularly from Iron Man 3, where he is discovering how to navigate PTSD and his panic attacks. Now, a little bit about his demographics. We're looking at an adult male, I'm assuming early 40s, white, American. He's also a billionaire engineer, a public figure, and he is in a committed relationship to Pepper Potts, and he also has a friend named Rhodey. Now, the seeking for support has started after escalating panic attacks and disruptions regarding his sleep, and his symptoms emerged after a battle of New York in 2012. His close friends, Rhodey and Pepper, have noticed impairment and are concerned for his health. And after the events of Iron Man 3, he is attending therapy for control and his nightmares. Now, for his presenting concerns, we are mainly looking at panic attacks via reminders of the New York battle. It does seem to be isolated to this main event in comparison to his other past traumas. He does have severe lack of sleep due to nightmares and intrusive memories and thoughts. While he is awake, he experiences major hypervigilance, and this has shown to be a significant strain on his relationships, which has led to avoidance of making suits or being stuck in a lab, and he is isolating himself. When we're looking at critical impressions, we're thinking of a trauma disorder, and the panic attacks appear to be linked to a particular stimulus regarding seeing pictures of New York or having loss of control. We also want to rule out medical, substance use, and other sleep-related contributors. But the biggest thing is that while he is functional in his day-to-day life, he is not emotionally available. When we're looking at his culture, we really want to explore masculinity norms, and his extreme wealth, while is very fortunate for him, it does enable avoidance behaviors, and his science background favors a logical system base and explanations. So you will need to lean on a ton of psychoeducation and understanding psychology in terms of biology. And technology is a major strength, but also an avoidance behavior for Tony Stark. So understanding these areas will be a major benefit within counseling. Now, looking at trauma history, he does have quite a series of events. When he was in his teens, he lost both of his parents and has unresolved grief. Later in his life, he was kidnapped and has multiple life-threatening injuries. He's also had multiple betrayal traumas by close friends, which has led to him becoming very skeptic and not trusting of others. For his symptomology, we're looking at intrusive memories. His physiological reactions are shortness of breath, mind racing, and all those sort of things. And then again, the avoidance and hypervigilance. Panic episodes appear to be happening when he's losing control and when he has his insomnia and nightmares. When we're looking at risk and protective factors, we're mainly understanding sleep deprivation, impulsivity. He has a major problem with self-sacrificing behavior and will often isolate himself. While he is incredibly intelligent, this can also be a avoidant behavior of trying to solve things without feeling his emotions necessarily. And he does have meaningful relationships and a very strong sense of purpose of protecting others. And another key benefit to Tony Stark is his ability to reflect. Now, I'm going to be skipping this video for right now, but essentially within Iron Man 3, he is talking to his friend Rhodey at a bar, and a child comes up with a picture holding a picture with Iron Man flying towards a black hole, and that immediately caused a panic attack where Tony Stark thought he was dying. And then throughout the film, we see several other panic attacks when he's losing control or uncertain of a topic, and it seems to be a major impairment in his life.
With focus.
Now, in my personal opinion, we are looking at post traumatic disorder. And for the assessment tools, I'm looking at the CAPS 5, the PCL 5, and the GAD 7. And particularly with the CAPS 5, what I really like about it is that it's interview based and it's really great for diagnosing PTSD. And while the other two are great for monitoring his anxiety and depression levels throughout treatment. Now, looking at what theories would work best for him, I am leaning towards trauma informed CBT and cognitive processing. And essentially, trauma has developed a deep need for control, which has influenced increased anxiety and hypervigilance. And avoidance for him works in the short term, but prevents long term growth, satisfaction, and relationships. And then when he is also deprived of sleep, this amplifies the arousal, and treatment should include safety, collaboration, choice, empowerment, and grace. In particular, what I like about CBT is that we're understanding the thoughts, patterns, and emotions that are leading to these behaviors that are unhelpful for him. And having a science background, this is the classic independent dependent variable, which would work best for his personality. Now, looking at contributing factors, we are understanding multiple near death experiences. He has major betrayal trauma with close friends, and he has this unrealistic sense of responsibility of needing to protect everyone and everything. And his identity is highly defined by competence. He has to be able to solve a solution and be sure that he is a savior in some kind of way. For his maintaining factors, we're looking at major avoidance and his sleep deprivation, but we also need to understand that he uses humor and sarcasm and is a major intellectualizer. For cultural considerations, we are going to be exploring mainly his masculinity and being okay with being vulnerable and seeing that as a source of strength versus a source of weakness. Now, for strengths and resources, he does have a very strong intelligence and good relationships, and he does have access to any treatments that are needed. But I think the biggest thing that we should focus on is his ability to be resilient and pivot as needed. He is learning and constantly adapting to new situations. And for himself, this is a situation that he is trying to solve, and understanding emotions would give him the tools to get to those goals. And then for mechanisms of change, I think it would be best to learn to take steps back, to stop over controlling, challenging fixated beliefs, improving his sleep quality, and develop an identity beyond being a protector. Now, with treatment planning, we do have some SMART goals. For 4 weeks, I think it would be best to identify triggers, warning signs, and develop grounding skills. This will lay a good foundation. 8 weeks, we should improve sleep quality. 10 weeks, we should be seeking support and communicating emotions at least 2 times a week. This could be looking like a 12-step program or a celebrate recovery group. And then every 12 to 16 weeks, I think we should be reducing the PCL5 score by around 10 points. In terms of evidence based interventions, we're looking at psychoeducation, grounding techniques, cognitive processing therapy, and communication skills to be vulnerable. Now, I think for culture adaptations, we need to use engineering language to explain trauma, and we should be expecting his intellectualization and sarcasm and control to come up and navigate that appropriately. For monitoring, I think the PCL5 should be done every 4 weeks, and we should also keep data of panic and sleep and track his avoidance. And for coordination of care, we need to rule out medical contributors, a psych consult, sleep specialties, and talk to Pepper and Rhodey regarding safety concerns. Now, for clinical discussions, I think understanding combat trauma and medical consultations would be helpful, and understanding alternate perspectives like panic disorder and generalized anxiety disorder, and so on. And then for ethical observations, we're looking at confidentiality, and we want to avoid those dual relationships. Now, my questions for supervision would be, how do we define control that is helpful but not avoidant? How do I avoid a power struggle? And how do I navigate psychoeducation and emotional vulnerability? And I think the next steps that would work best for Tony Stark would be establishing a safety plan, a sleep plan, and begin psychoeducation and grounding, and then track symptoms. And then these are my references. If you have any questions, please feel free to let me know. But this was a great assignment. All right.